So today I'm going to try and give you a really good example of what a Medicare supplement presentation should look like. Hi, my name's Jeremy Smith, and over the better part of the last 15 years, I've been an agent, a manager, an owner-operator of a brokerage, and over the last 6 years, I've been a business coach traveling the country and trying to help agents and agency owners grow their practice. Stay with me because today I'm going to try and help you grow yours. If you're familiar with YouTube, then you know the game. Please like, subscribe, and ring the bell. So, I want to start off today by obviously reviewing your Medicare supplement. Obviously, you've got a Medicare supplement right now, so I know you have a pretty good idea of how it works. But let me just take a couple seconds here and just kind of review the whole Medicare system in general. When it comes to Medicare, once we turn 65, we then become eligible for Medicare. And that's Medicare Parts A and Medicare Parts B, which is your doctor and your hospital. Unfortunately, Medicare only covers about 80% of all of our doctor and hospital bills, and so that's why most people will purchase what they call a Medicare supplement to cover that gap or that other 20%. And then they may get also on top of that what they call Part D, which would be your prescriptions and drugs. When it comes to Medicare supplements, most people out there before now have always had what they call Plan F, which is what you've got right now. Plan F has always been the most comprehensive plan that's out there. But starting at the 1st of 2021, they're no longer going to be able to offer a Plan F Medicare supplement if you don't currently already have it. The most comprehensive plan going forward is what they call Plan G. Plan G is exactly the same as Plan F with one difference. It does not cover your Part B deductible, which is the first $183 of your doctor bills every year. So it's kind of like back when you were on regular health insurance, when you were working, you might have had a little copay or deductible and then your insurance kicked in. Medicare is exactly the same now with a Part G Medicare supplement. You're going to pay that first $183, and then between your Medicare and your Medicare supplement, most of your bills should always be paid. The cool thing about this change is that you might have Plan F now, like a lot of people, and you're probably going to be switching maybe to Plan G. Yes, you're now going to have to pay the first $183 a year from a premium standpoint, but in your scenario, your savings from where you're at right now with Blue Cross to where we would be talking about putting you to is $480 a year. So it more than pays for that deductible. It's times 3 actually. Okay, so there's still a lot of savings in moving from your current company with a Plan F to the new company with a Plan G. In fact, I see you've got your Medicare and Me, your guides that Medicare sends you every year. If you turn to page 19 in this guide, it's going to show you, big and bold, right there, that Medicare writes, the most important thing when it comes to looking at getting your Medicare supplements is understanding that every company in the country is regulated by Medicare and they're all exactly the same. Okay. The only difference is price. So you don't take my word for it. That's from Medicare. You can call 1-800-MEDICARE, you can call SHIPS, you can ask a lot of third parties of what I'm telling you, that the only difference is price. And so I, fortunately, because I'm an independent broker, I've got access to every company in the country. I can show you prices with all of them, and together we can figure out which one you want to go with. The one I've got you set up on right now, like I said, saves you about $450 a year for basically the exact same coverage you had before, with the exception of the Part B deductible you'll pay each year. Okay? Let me explain to you a little bit how the process works. I don't have a new Medicare supplement in my back pocket that I can give you today, so really the process would work like this. If everything I've said to you makes sense, what we would do today is I would do a quick application on you, make sure I can get you approved. It's pretty easy. There's 17 or 18 health questions we just got to roll through. I'll have a really good idea at that point whether you can qualify or not. We'll probably go through and just do a quick little phone interview. It'll take us about 7 or 8 minutes. I'll send the application into the insurance company. It'll take them a week and a half to call me back and get me an actual approval on you. I'll let you know when we've got an approval. And then if you want to make a switch, what we'll do is we'll cancel your current coverage and start this coverage at the beginning of next month. So there's no gaps at all. And I'll come back and help you with doing that.
Sounds good.
So I know that was maybe 2.5 minutes. A Medicare supplement presentation is not super long. It's not super comprehensive. It's that easy. And again, one of the big reasons why I'm trying to inspire those of you that aren't offering Medicare supplements to start offering Medicare supplements. Keep in mind that the examples and stuff I did today as far as numbers and stuff are just examples. Those deductibles and the premiums, obviously, all that stuff changes on an annual basis, if not even sooner than that. But I just wanted to give you an idea of what a Medicare supplement presentation would look like. You do not have to be this Medicare guru that you understand exactly how everything in the system works to be able to walk into a customer, a prospect, or a client's home and say, tell me what you're paying for your current coverage. Your only real salesmanship point you have to make is explaining to them that they're all the same. The only difference is price. And like I did in my role play, they probably have the Medicare guide that you can go and use as a third-party resource that literally says that exact statement. I hope this kind of tied things together a little bit for you, and I really hope you start adding this into your practice. I think it's a good way for you to make some quicker money. It's a good way for you to make some clients, and it's a good way to make your life insurance sales even easier because you've created that premium and that savings in which to pay for the life insurance sales. Don't forget to like and subscribe and ring the bell, and we'll look forward to seeing you next week on our next video.